vlog today is all about my favorite labor induction strategies. Now, this is the same list that I provide to my patients and is something that I am starting now that I'm in my 37th week of pregnancy and my baby is full term. So any of these strategies are safe for you to start at 37 weeks when your pregnancy is viable and it's safe for you to have the baby at any time. So starting off with number one is exercise. I've been really sedentary these last few months due to doctor's orders, so I am excited to finally get outside, start walking, especially on a beautiful day like today. So I started my day with a nice brisk walk, hence you can see I'm a little bit flushed. My second favorite strategy is acupuncture. Now this strategy does have some positive research and does have one positive study in particular that showed, let me just pull it up here. This strategy showed that 70% of women who participated in acupuncture in this randomized controlled trial went into labor on their own compared to 50% who did not receive acupuncture. And the women that received acupuncture were also less likely to deliver by C-section compared to those that do not. So using acupuncture as a strategy for labor induction is something you can start once per week, is my recommendation at 37 weeks. And then I increase that to twice a week in week 40, and then if you go past your due dates, up to 2 to 3 times per week. And you can do that with your naturopathic doctor, you can do that with a licensed acupuncturist, traditional Chinese medicine doc, chiropractor, somebody that has received an additional training and license in acupuncture treatment. If acupuncture is not your thing, or in between your acupuncture appointments, another thing that you can do is something called acupressure. Now acupressure, instead of using acupuncture needles, you're going to put pressure on the same acupuncture points that are used to induce labor. So what those are, there's a fleshy spot in between your thumb and your first finger, and you can squeeze that yourself or get your partner to do it for you, and it should create a little bit of a tender sensation. So try and massage and put pressure on that point on both sides for about a minute at a time, alternating. Another one that's really great is if you sit in front of a friend or a partner and you get them to put their elbows into the top of your trap muscles right here. It feels really good as well because that's an area that we carry a lot of tension, and just get them to put that pressure down on the top of the trapezius, again for a minute, 2 minutes, longer, because it feels good. The last point is on the ankle. It's about 3 inches up from the middle of your ankle on a tender spot on the inside of your foot. Now this point is called spleen 6. You can look it up online if you want, because it's a little hard for me to show right now, but that is another great point. And these are also acupressure points that you can use for pain management in labor. They work really great for that as well. So those are my 2 favorite strategies. Some other strategies that you can use, something called red raspberry leaf tea. Now, using this tea and drinking pot upon pot will not induce labor. Research doesn't show positive induction or initiation of labor strategy, but what the research does show is that red raspberry leaf tea can help to create more efficient contractions in labor and bring about a shorter labor. So it makes your labor and your contractions a lot more efficient. Another technique that doesn't really have any research, but it's a fun one to do, is to start eating some spicy foods. The theory behind this is that spicy foods irritate the intestines and the colon, and then in turn will cause irritation to the uterine wall, which will stimulate contraction. So that's a fun one. So go out and get your Thai food takeout from your favorite restaurant. Another one would be to use an exercise ball, like one of those big exercise balls, sit on it, do some bouncing, swivel your hips around in a circle. We want to loosen up those ligaments in the hips, the pelvis, the sacrum to make the baby's descent into the cervix a lot easier and to help, because those muscles do tend to get really tense and tight in pregnancy. So loosening them up is a great labor induction strategy. You can also do that through regular body work, whether that's with your chiropractor, an osteopath, a massage therapist. I do recommend, and I have myself been using those strategies throughout my pregnancy to keep my body adjusted and my hips and pelvis loose and open as much as possible. That includes doing yoga, getting down on your hands and knees, doing cat-cow pose, using child's pose. Those are also great positions that you can do for a malpositioned baby. So getting down on your hands and knees will help better position your baby for a more efficient labor. And also getting busy in bed. So having sex is also a labor induction strategy. The prostaglandins within semen helps to ripen and soften the cervix as well. So that is also another great strategy that you can use. And then we can't forget about the power of our mind. So if there are any hesitations that you're feeling towards labor, delivery, bringing your baby into this world, you want to explore that, because where the mind goes, the energy flows. So if you're feeling very hesitant about the process, about the experience, very nervous about bringing your baby into this world, then you're going to want to explore that. Journal, do meditations, work with a professional, and really focus and create images in your mind of a positive experience as much as possible, and that will also help to initiate labor. If you're not feeling too inclined on having this baby in this world with you, then he's not going to come. So we want to make sure that that's a strategy that we explore. Okay, I think that's it. Those are my top favorite strategies. None of them are a guarantee, but they're kind of fun. So I hope that you choose to participate in one or two or all of them. And if you have any that you want to share with me, I would love to hear those. So please comment in the comment section below. So wish me all the best as I start hoping to induce my own labor. See you later.